This is the Harris County Department of Education Returning Staff Orientation for 2013-2014. Welcome. We are pleased to share with you new processes and information about various changes that transpired since we last met. We are pleased to tell you that we instituted an employee referral program because HCDE's excellence is defined by the dedication of its staff. Employees not only bring their best work each day, but the example they set gets noticed. Qualified individuals you refer to HCDE who apply later for full-time employment are hired and work at least 60 days can help you receive reward bucks. Details about this plan are located on the HCDE portal under Human Resources. Emergency Response Plan flyers were created to replace the former emergency plan flip charts. We condensed the information to an easy-to-print and store resource. A copy is printed in the back of the employee handbook. Color copies are also available from Human Resources upon request. Human Resources periodically survey staff to ascertain areas of interest and need regarding professional development. We put together a schedule of voluntary and mandatory trainings to be offered over the course of the school year. These trainings are always free of charge to HCDE staff. We are pleased to provide a number of trainings through electronic delivery, making it easier to participate. A complete list of trainings will be distributed through HCDE's email system, so watch for invitations and sign up through the HCDE Workshop Management System, WMS. We are pleased to announce that returning staff orientation is now offered through electronic means or webinar, making it easier for staff who are unable to travel to Irvington or North Post Oak to log in and participate in the mandatory returning staff orientation. We anticipate that new employee orientation will follow suit. We will keep you posted on this development. Forging ahead into 2013, we welcome 4 new board members coming on board this year. They are Ms. Erica Lee Carter, Dr. Diane Troutman, Ms. Kay Smith, and Mr. Howard Jefferson. Also, HCDE's mission statement and goals have been amended. Our mission is clarified as Catalyst for Excellence in Educating All Learners, and our goals have been revised. See the front of your employee handbook and familiarize yourself with our mission and goals. Each year, we bring selected personnel policy changes to your attention. We encourage you to access HCDE board policies online. Instructions are located on page 5 of the employee handbook. For new hires, vacation days are prorated beginning the month the employee is employed prior to the 21st day of the month. Those days are made available in January of the following year. Upon reaching 10 years of service, vacation is awarded on a prorated basis beginning the following year. For example, an employee hired in 2002 reaches 10 years of service in 2012. In January 2013, the employee receives 12 days of vacation from the previous year's prorated calculation, not the full 15 days. In January 2014, the employee will receive 15 days for the 2013 calculation. As always, vacation days do not accumulate while an employee is out on unpaid leave status. However, vacation days do accumulate on a prorated basis based on the days worked in the year. An employee may not work while on family medical leave or temporary disability. Employees on discretionary leave or vacation leave may not work for an independent school district, other government entity, other employers, or as consultants. Violation of this policy may be grounds for termination of employment. There are a few new sections added to the DH local policy regarding electronic media. Defining electronic media includes, but is not limited to, all forms of telecommunications such as landlines, cell phones, and web-based applications. Of course, it includes social media such as text messaging, instant messaging, electronic mail, weblogs, electronic forums, chat rooms, video sharing websites, editorial comments posted on the internet, and social networking site. You are reminded that your use of this medium requires you remain compliant with the Public Information Act and FERPA, the Family Educational Rights and Privacy Act, as well as maintain the same professional standards in your use as for any other public conduct. If an employee's use of electronic media violates state or federal law or department policy or interferes with the employee's ability to effectively perform his or her job duties, then the employee is subject to disciplinary action up to and including termination of employment. Remember, the department's electronic data management systems will be used only for administrative and educational purposes consistent with the department's mission and goals. A copy of the CQ logo policy is printed in your handbook. We added the Employee First Report of Illness or Injury form and list of Concentra medical clinics, maps, hours, and locations to the HCD website for ease of access. These materials are also located on the portal under Human Resources, Workers' Comp. There are a few procedural changes. Going to Concentra, you should have with you the Workers' Comp identification form to physicians and a copy of your job description. HIPAA released information has been added to the physician form that should be signed by you should you seek medical attention anywhere other than Concentra. Should you not have these forms with you when you go, contact Human Resources while at the medical facility and these forms will be faxed directly to them. Please take some time to review the general safety precautions, including information regarding fire safety and ways to prevent trips, slips, and falls. Safety is everyone's responsibility. The Texas Department of State Health Services, TDSHS, requires employers to present 14 points of information to staff annually. We remind you to review all 14 points in your handbook. We discuss key points to help you reduce or eliminate your risk of exposure to bloodborne pathogens. First, HCDE has a committee to review our exposure control plan, which we refer to as our Bloodborne Pathogens Manual, to make sure that processes are current. Paper copies are located at all sites and the full PDF version is located on the HCD portal under Human Resources Manuals. By recognizing behaviors and conditions that may put you at risk for exposure to bloodborne pathogens, you can take measures to reduce that risk. Employees whose positions put them at a high risk of exposure are provided the opportunity to receive no-cost hepatitis B vaccines. If you have already had the HBV vaccine, then you do not need to receive them again, but you must have had all three. Check your job description or contact Human Resources if you are uncertain if your position is one that is at high risk of contracting hepatitis. Hepatitis B or HBV and hepatitis C or HCV are transmitted through blood and or body fluids. Blood contaminated with HBV or HCV may remain contaminated on any dry surface for up to 1 week. Most people do not know that they have contracted HBV or HCV because the symptoms are flu-like. The only way to test for the presence is through a blood test, and most people do not go to the doctor when they feel they have the flu. There are control methods in place. The use of personal protective equipment, PPE, is vital to reducing contamination. Examples of PPEs include strong utility gloves and disposable latex gloves. These PPEs are made available to you at all locations. Follow proper procedures for glove removal located in the BBP manual and demonstrated on the BBP video presented to new employees. Proper housekeeping ensures that the worksite is maintained in a clean and sanitary condition, which also helps reduce exposure. Other control methods include treating everyone as if they potentially have BBPs, since you cannot tell by looking at someone. Do not attempt to clean up an area if you have not been properly trained to do so. Custodial staff at HCDE is trained annually. What should you do if you feel you have been exposed to BBPs? Do not panic. Carefully remove your personal protective equipment and immediately wash your hands with soap and warm water. If you are concerned and would like to seek medical advice and treatment, contact your supervisor and Human Resources and visit a Concentra medical center. Follow all procedures regarding workers' compensation, including completing an employee exposure incident form located on the portal. There's a list of do's and don'ts regarding keeping yourself safe printed in the employee handbook. Staff should be vigilant and monitor their surroundings when approaching or leaving their vehicles. Always have your keys ready and always lock your car immediately upon entering. If you are involved in an accident in your personal vehicle while conducting work-related business, contact your supervisor and Human Resources immediately and follow workers' compensation procedures regarding seeking medical assistance. A copy of the police report should be submitted with a workers' comp claim. Car repairs should be reported to your auto insurance. If you are involved in an accident in an HCDE provided vehicle, contact your supervisor and human resources immediately and follow workers' compensation procedures if necessary. If you receive a traffic or parking citation while using a department-owned or leased vehicle or rental vehicle, you are responsible for paying the fine. Contact your supervisor and human resources immediately. Drivers of ACD-owned or leased vehicles, as well as drivers identified as working in safety-sensitive positions, must view a driver safety video and complete a requirements for drivers of department-owned or leased vehicles form each year. Much has been said about the seriousness of cell phone use distracting drivers. Safety must come before all concerns. Cell phone use and/or texting is strictly prohibited while driving in the school zone. Policy FFI outlines the seriousness of bullying and actions that must be taken. All employees are required to report complaints of student bullying to the principal or director of special schools. Examples of bullying a student may include hazing, threats, taunting, teasing, confinement, assault, demands for money, destruction of property, theft of valued possessions, name-calling, rumor spreading, or ostracism. Investigations are conducted and timelines are attached to this as well. Note that an investigation should be completed within 10 department business days. This policy has been added to the handbook for ease of access. We remind all employees to act with integrity and diligence in duties involving the department's financial resources. Not only are forgery and misappropriations identified in this policy, but also accepting or seeking anything of material value from contractors, vendors, or other persons providing services or materials to the department, except as otherwise permitted by law or department policy, is prohibited. Also, inappropriately destroying, removing, or using records, furniture, fixtures, or equipment is prohibited. See the handbook for additional information. The DHE local policy regarding searching and/or alcohol or drug testing is included in the employee handbook. While working for ACDE, the organization has a right to search where there is a reasonable cause and has a right to conduct random drug tests of employees in safety-sensitive positions and drivers of commercial motor vehicles, including school buses. One of the most important changes this year is that TRS Active Care 1 has been consolidated with Active Care 1 HD. All enrollees in the current Active Care 1 and Active Care 1 HD will automatically be migrated to the new Active Care 1 HD, effective September 1, 2013, unless they make another election during open enrollment ending August 31, 2013. The new Active Care 1 HD will have an individual deductible of $2,400 per plan year and the out-of-pocket maximum, excluding deductibles, of $3,850. The family deductible will be $4,800 with a $4,200 out-of-pocket maximum, excluding deductible. The individual deductible for Active Care 2 will increase from $750 to $1,000, and the out-of-pocket maximum expenses, excluding deductibles and copays, for Active Care 2 will increase from $2,000 to $4,000. The family deductible will be $3,000 with an $8,000 out-of-pocket maximum, excluding deductibles and copays. Copay amounts for a 31-day retail supply of prescription drugs under Active Care 2 will increase by $5. Currently, retail is limited to a 30-day supply. Premiums will change for all three Active Care plans to reflect cost increases. The chart shows a brief comparison of plan features, including deductible amounts, out-of-pocket maximums, and copayments as described by the plan. Taking into consideration the deductibles and copayments, you should decide which plan is right for you. Remember to factor in the premium cost with the other costs to understand your financial risk. This information is located in the TRS Active Care Enrollment Guide that was distributed to all benefits-eligible employees in April of this year. Rate sheets are located on the HCD portal under Human Resources Benefits. If you have any questions regarding benefits, contact Human Resources. The FMLA legal policy has been carved out of the current DHC legal policy and renamed DECA Legal. Worksite postings and employee notifications have also been updated since we last met to include changes in the military family leave entitlements. A copy of the newly revised poster is printed in the back of the employee handbook. Human Resources is receiving many questions regarding absences. Please note that intermittent or reduced leave is not applicable due to birth, adoption, foster care, or placement of a child. Are you considering selling your home, reviewing legal documents, or wondering if you can sue your neighbor? Perhaps you should contact your Employee Assistance Program first. Did you know the EAP provides 30 minutes of legal or financial counseling free of charge to you and any family members living with you? Use this helpful resource for other personal family issues. They can help. Details are located on the portal under Human Resources and in the current Employee Handbook. For school years 2013-2014 and forward, your annual salary for TRS purposes will be the eligible salary payments reported to TRS from September 1st through August 31st of each year. In other words, rather than basing your annual compensation on the amount earned during your contract period, TRS will calculate your benefits using eligible compensation reported to TRS on September 1st through August 31st monthly reports. This is in accordance with the implementation of the standardized school year adopted by the 82nd Texas Legislature. While TRS does not require employers to align employee contracts or the employer pay schedule with the standardized school year, it is important for employers and members to understand the annual salary credited by TRS in the 2013-2014 school year and future school years. Further, if you retire at the end of your contract period, you may not receive credit for 12 months of salary in your final year before retirement. An employee who has paid any portion of his or her new contract salary prior to September 1st of each year is most likely to be affected in his or her final year of employment by this change in how salary is credited using the TRS standardized school year. What does this mean for you? The new definition of school year may affect the salary credited by TRS in your final year before retirement. If you receive one of your highest salary rates during your last year of employment, you may not receive retirement benefits based on the higher salary rate if 12 months of salary is not reported. For more information, please visit the TRS website or contact Human Resources. This is a good time of year to review your beneficiary listings and W-2 withholding amounts. Use the HCDE Employee Access Center. This site has been updated to include a payroll calculator. Now you can see exactly how your paycheck will be affected when you make financial changes, so there won't be any surprises after those changes are made. Please remember that you are in a work environment and that you set an example for those you serve and the community. Rules regarding the dress and appearance policy are printed in the handbook. Generally, staff must refrain from wearing tank tops, leggings, windsuits, shorts, athletic gear, flip-flops, and spandex. If your job allows for other dress requirements, then follow those guidelines and always try to look your best. HCDE requires staff pay into Social Security system and the Teacher Retirement System. Employees may voluntarily participate in additional retirement plan options, the 403B and/or the 457 plan. As with any voluntary investment plan, there are risks. Read more about these plans in the handbook and contact Human Resources at any time throughout the year to enroll. You may learn more about accessing the website at www.jempta.com. Employees may also schedule to meet with a representative from JEM Resource Partners to assist with personal retirement plan investing. Contact Human Resources for appointment dates. There is only one form that you are required to complete and submit today: the Employee Handbook Acknowledgement Form, located inside the front cover of the 2013 Employee Handbook. Optional forms including the Catastrophic Sick Leave Donation and Flower Fund forms. Each year, to remain a member of the Catastrophic Sick Leave Plan, you must contribute at least 1 day to the bank. New members must make an initial contribution of 3 leave days. The Flower Fund donation is a one-time $7 charge that will be deducted from your pay in the month of October. Remember, your generosity is the only means by which HCDE can provide this benefit. The Employee Annual Giving Fund may be completed and submitted at any time throughout the year. Select which division you would like funds to be distributed to. A donation will be accepted at any time of the year. Complete the form and forward it to Human Resources. Remember that the request for outside employment form must be completed each year and submitted to your individual supervisor if you hold employment in addition to working with HCDE. Benefit contract cards for 2013 will be sent via interoffice mail upon request. The HCDE Human Resources team is here to assist you at any time. We would like to wish you the best with enthusiasm and promise for the new school year. This concludes the 2013-2014 Returning Staff Orientation.